Hello and welcome to our channel. In this video we will discuss about acidosis, and the topics that we will cover in this video are: what is acidosis, what are the causes of acidosis, that is what is the basic etiologies that leads to acidosis. Then next we'll talk about the risk factors. Then next, what are the clinical features of acidosis, that is what are the signs and symptoms. Then next we'll discuss about the diagnostic criteria, that what are the investigations that you can perform if you are suffering from acidosis or if you have any doubt that you are suffering from acidosis. Then lastly we will discuss about the management and the prevention of acidosis, very important. So these are some basic topics that we will cover in this video. So let's start. So first of all, let's talk about it now. So what is acidosis? So when your body fluids contain too much amount of acid, it is known as acidosis. And acidosis occur when your kidneys and your lungs cannot keep your body's pH in balance, and many of the body's processes produce acid. Your lungs and your kidneys can usually compensate for slight pH imbalances, but problems with these organs can lead to excess acid accumulating in your body. So this is the exact meaning of, and the acidity of your blood is measured by determining its pH. A lower pH means that your blood is more acidic, while a higher pH means that your blood is more basic. The pH of your blood should be around 7.4, and according to the American Association of Clinical Chemistry, acidosis is characterized by a pH of 7.35 or lower. And now we'll also discuss about alkalosis. What is alkalosis now? So alkalosis is characterized by a pH level of 7.45 or higher. While seemingly slight, these numerical differences can be serious, and acidosis can lead to numerous health issues, and it can be even life-threatening. Now next we'll discuss about what are the causes, what are the two types of acidosis, each with various causes, and the types of acidosis is characterized as either respiratory acidosis and metabolic acidosis, and depending on the primary causes of your acidosis. So first is respiratory acidosis and its causes. Now what is respiratory acidosis? So respiratory acidosis occurs when too much carbon dioxide built up in the body. Normally the lungs remove carbon dioxide while you breathe. However, sometimes your body cannot get rid of enough carbon dioxide, and this may happen due to: first, chronic airway conditions like asthma. Second, injury to the chest. Thirdly, obesity, which can make breathing difficult. Next is sedative misuse. And next is overuse of alcohol. Next is muscle weakness in the chest. Next is problems with the nervous system. And last one is deformed chest structure. So this was all about the respiratory acidosis. Now secondly, we'll talk about what is metabolic acidosis and what are the causes. So metabolic acidosis starts in the kidney instead of the lungs. It occurs when they cannot eliminate enough acid or when they get rid of too much waste. There are three major forms of metabolic acidosis. First one is diabetic acidosis, second is hypercholemic acidosis, third is lactic acidosis. Now one by one we'll talk about them. So first one is diabetic acidosis. So it occurs in people with diabetes that is poorly controlled. If your body lacks enough insulin or the ketone buildup in your blood and acidify your blood. Second is hypercholemic acidosis. So this results from loss of sodium bicarbonate. This base helps to keep the blood neutral. Both diarrhea and the vomiting can cause this type of acidosis. And third is lactic acidosis. It occurs when there is too much lactic acid in your body. It can causes can include chronic alcohol use, heart failure, cancer, seizure, liver failure, prolonged lack of oxygen, and low blood sugar. Even prolonged exercise can lead to lactic acid buildings. And another type is renal tubular acidosis. So it occurs when the kidneys are unable to excrete acid in the urine. This causes the blood to become acidic. So these are some causes or the etiologies that leads to acidosis. Now next we'll talk about what are the risk factors of acidosis and who are the person which are prone to these risk factors. So factors that can contribute to your risk of acidosis include: first, a high fat diet that's low in carbohydrates. Secondly, kidney failure. Thirdly, obesity. Fourth is dehydration. Next is aspirin or the methanol poisoning. And last one is diabetes. So these are some risk factors. Now next we'll talk about the clinical features of acidosis, that is what are the signs and symptoms of acidosis. Now let's talk about them. So both, as we have already talked about, both respiratory and the metabolic acidosis shares many symptoms. However, the symptoms of acidosis vary based on its causes. So first of all, we'll talk about the respiratory acidosis and its clinical symptoms. So some of the common symptoms of respiratory acidosis include fatigue or drowsiness, you can say. Secondly, becoming tired easily. Third is confusion of mind. Fourth is shortness of the breath, or simply you can say dyspnea. Next is sleepiness. And last is headache. Now next, the metabolic acidosis and its clinical features. So some of the common symptoms of metabolic acidosis include the following clinical features. First is rapid and shallow breathing. Second, confusion of the mind. Third, fatigue. Then headache. Then sleepiness, lack of appetite, and very important, jaundice. Next is increased heart rate. And last is breath that smells fruity, which is a sign of diabetic acidosis, or simply you can say ketoacidosis. So these are the clinical features of acidosis. Now next we'll talk about the investigation, that is what is the diagnostic criteria that you can perform. So let's talk about the tests that you can perform in order to diagnose whether you are suffering from acidosis or not. So let's talk about investigations. So if you think you may have acidosis, so go to the doctor immediately. Early diagnosis can make a big difference in your recovery. Doctors diagnose acidosis when a series of blood tests. First of all is blood test. An arterial blood gas look at the level of oxygen and carbon dioxide in your blood. It also reveals your blood pH. Second, a basic metabolic panel which checks your kidney and your pH balance, protein, blood sugar and electrolyte levels. If these tests are taken together, they can identify different types of acidosis. Next, if you are diagnosed with respiratory acidosis, your doctor will want to check the health of your lungs. They may include a chest X-ray and the pulmonary function test, that is PFT. Next test is, if metabolic acidosis is suspected, so you will need to give a urine sample. Doctors will check the pH to determine the cause of your acidosis. So this was all about the investigation. Now next we'll talk about the management part and prevention, very important. So if you are suffering from acidosis, then what you can do. So let's talk about the management and prevention. So first of all, acidosis prevention. So you cannot completely prevent acidosis. However, there are some things you can do to lower your risk. So first, for the respiratory acidosis. So for the people who are suffering from respiratory acidosis, so you can do the following steps to reduce your risk for the respiratory acidosis. First, take sedatives as prescribed and never mix them with alcohol. Second, stop smoking. Smoking can damage your lungs and make breathing less effective. Thirdly, maintain a healthy weight because obesity can make it harder for you to breathe. Second, for the person who is suffering from metabolic acidosis, so what they can do. So you can do the following things to reduce your risk of metabolic acidosis. First, stay hydrated. Drink plenty of water and other fluids. Secondly, keep control of your diabetes If you manage your blood sugar level well, you can avoid ketoacidosis. Third, stop drinking alcohol. Chronic drinking can increase the buildup of the lactic acid. So these are some preventions that you can follow if you are suffering from acidosis, or preventions that you can try. So this was all about the management part of acidosis. So that's all in this video. We have discussed about acidosis. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, press the bell icon for more updates. Stay safe and stay healthy. And yes, thanks for watching our video.